Parents of youthful family in insignificant illnesses should get them to pharmacies quite rather than GPS or A&E, a new NHS England campaigning says. It follows a examination that found fair 6% of parents in by-5s would go to a chemist at first. NHS England told visits to GPS and A&E for these personality treatable facility, love belly pain, price £8.50 metre a year. But parents should not be put off vision a physician, a patient's team told. GPS leaders told parents of family in a really top heat how doesn't go off should yet search assist of a care specialist. NHS England's Remain So drugstore campaigning is calling human beings to trip their regional chemist, at first to assist rescue the facility cash and complimentary up period for the sickest patients. It told every year down there were on 18 millionth GP serving and 2.1 millionth visits to A&E for as called personality treatable facility, standing the facility the counterpart of more than rather than 220,000 hip replacements or 880,000 walleye operative. Its examination of more than rather than 2,000 human beings in England found 35% of parents of family by 5 would go to a GP if their kid had a insignificant disease, such as ear pain, diarrhea, or belly pain. 5% would go immediately to A&E. The NHS examination as well found how just 16% of adults would go to a chemist at first if they were as unhealthy. Dr. Bruce Warner, Vice Head Pharmacy Official for NHS England, told, "Pharmacists are very learned NHS public health professionals who are capable to propose clinic consultation and efficient treatments for a broad band of insignificant public health concerns down there and later. They can evaluate symptoms and encourage the top year of treat or just ensure assurance for copy while a insignificant disease will get superior on its own in a few days otherwise. Yet, if symptoms propose he's thing more than severe, they include the law clinic learning to provide human beings get the assist they requirement." Yet, the patient's associate told it was essential parents did not sense put off of vision a physician if they mind thing more than severe was incorrect. The Mercy's head execution, Rachel Force, told, "To overall infancy illnesses, a chemist will frequently be a reasonable at first seaport of urge, so we greet efforts to lift knowledge of the supporting they can propose alike. We wouldn't wish to see parents put off take their family to see a physician if they include any suspect how thing more than severe could be incorrect. The campaigning has its being, the synchronization is not a overlap. The pressures cladding the NHS following year of insufficient financing and poor management of its labour build a enormous stimulus to prevent human beings of with GPS or A&E. Frequently human beings will be law to use alternatives, but we don't wish to listen of more than cases wherever who has remaining off and later go to severe damage since they were in reality severely bad. The King's School of GPS told patients can assist to ease the intensive blood pressure on GPS by searching consultation of a chemist, who they told were very skilled care professionals. Yet of year, they are not GPS and in an disaster or position wherever truly uncertain, patients should ever search specialist care aid, especially if parents see potential severe symptoms in their kids such as a really top heat how doesn't answer to easy measures, features of dewatering or apathy, told Chairman Professor Helen Stokes-Lampard. The NHS's Remain So drugstore campaigning will characteristic a TV advertisement and digital and public print advertisement.